Welcome everyone, Dr. Mandell here. Millions of people are suffering with neck-related conditions, like pain along the arm, tingling into the hand and fingers, into the shoulder, between the shoulder blades, or even into the chest. Well, guess what? This particular technique may do wonders for you. This is about trigger point therapy affecting the scalenes muscles. So our intention is to release those trigger points and stretch and elongate those contracted muscles. By doing so, you may notice immediate relief. There are three scalene muscles: the anterior, the medial, and the posterior. The anterior and medial scalenes are the ones that we're concerned about. Between those two comes out the neurovascular bundle. That's the brachial plexus. That's the group of nerves that come off the neck between the discs, those nerves that make up and form that brachial plexus. That goes into the shoulder, down the arm, into the hands and fingers. Along that brachial plexus is the vascular bundle, is the vessels that travel along with it. So by us releasing the anterior and medial scalenes muscles, we're going to reduce nerve irritation and excel the healing process. So the important landmark is the SCM muscles. In other words, the sternocleidomastoid muscle. As I turn my head to the left, my right one comes out. I can take my hand and put pressure against my hand, and you can feel it protrude even more. So do that on yourself, and you'll get the landmark of that SCM muscle. Well, right behind that SCM muscle is the anterior scalenes. You have to take your fingers, as you turn to the left, grab that SCM muscle, come back into the middle, and take your fingers, your two fingers, and trace it down behind that SCM muscle and go down to the clavicle, all the way down near the collarbone. And if you push back in that area, that first muscle right in here, you're going to feel that anterior scalenes muscle. If you look at this trigger point chart, you can see those main areas, those 4 or 5 points on the lower part of the anterior and medial scalenes region. Those are the areas we want to try to locate. So let's show you how to combat these trigger points to get you feeling well. I'm focusing on my right side. I'm going to turn my head to the left. As I put pressure against my hand, you feel that right SCM come out. Grab it, trace it all the way down. As you come right behind the right SCM, you'll feel that anterior scalenes muscle. Start low, you can see those trigger points, and you just try to search for those trigger points, and you'll notice if something's real sore, or when you put pressure in there, you may feel it radiate down the shoulder blade, into the shoulder, down the arm, into the front of the neck, into the chest. And if you feel that radiation of pain, you've hit that trigger point, and by taking your fingers and going in little circular motions over that trigger point, those symptoms are eventually going to disappear. You're going to do the same thing right behind that anterior scalenes. You're going to go to the medial scalenes, and you'll do the same thing. You'll try to find those points that are real sore. Take 2 fingers or 3 fingers, whatever is good for you. Go in little circular movements. About 15-20 seconds. It's going to be real sore until that soreness goes away. But as you continue to put pressure on those muscles, you may feel it radiate to a different area. That is called referred pain. Those are the trigger points that's causing your referred pain. You want to release those trigger points. That's going to get you feeling well real quick. So after we release those trigger points for several minutes, now we need to elongate and stretch those scalenes muscles. Okay, so the first thing we're going to do is we need to grab onto something on the same side. I'm going to stretch my right side. Imagine me sitting. Okay, I'm grabbing under the chair, okay, and I'm pulling it nice and tight so I can lock this right shoulder down. I'm going to take my left hand, grab it over my other side of my skull here, and I'm going to pull it straight over. This is going to work our medial scalenes. Now watch closely now. after about 15-20 seconds, I'm going to have you bring your head back, and you're going to pull back to that side, and that will be working your anterior scalenes. Then after you do that, you're going to bring your head more forward and take your chin and bring it to your same armpit right there and pull it down to the left like this, and you'll feel it working the posterior scalenes. Great stretch. Nice to elongate that area. After about 20 seconds, you have completed all your stretches. So if you work in the left side of the neck, turn your head to the right, push your head forward, feel the SCM come out, take your fingers behind the SCM, there's the anterior scalenes, come down to the clavicle down here, and as you go backwards, you'll have the medial and then the posterior. When you stretch it, lock this left arm out, pull it straight over, that's medial. If you put your chin down to your armpit, pull it down and forward, that's posterior. And if you go to the side and go backwards, then that's going to be anterior. That's going to be a big asset for you. There are going to be hundreds of thousands of people that's going to get great results from this video, because many of these chronic problems that you've been suffering with for weeks, months, or even years can go away like that, particularly if those trigger points are exacerbating those nerve roots. I really hope that this makes a huge change for you. Please share this on your social media. Let's help educate others worldwide. We'll be doing a big asset for them and their family. Leave your comments below, and most important, make it a great day. I'm Dr. Mandell.